Okay, next question is from Paula Tromby regarding healthcare.
Oh, should I hold it?
Okay.
You'll hold it, okay.
Yeah.
I have to tell you that I am very disappointed, of course, that you voted for the repeal of health care. My husband is self-employed, and so we have our health insurance through NASE, which is the National Association of Self-Employed. And I got a letter, I think about November, letting us know that they are leaving the state so that we have to have another provider. And there's always been so much talk about, I'd like to have what Congress has. So I actually don't know what you get for health insurance. I mean, I know how much I pay, and how much, and it's very costly. And now I'm going to look for somebody else. I wondered if you know what it is that Congress pays for health insurance on a monthly basis. Do you have high deductibles? Do you have co-pays? Are you insured whether you or any member of your family has a pre-existing condition?
Can I ask a follow-up before I answer? You said the NASE is leaving the state, and they sent you a letter. Did they tell you in the letter why they're leaving the state?
No, they haven't. They did not tell, and I haven't actually followed up yet.
Okay.
And I should say, I get it through NASE because you buy in bulk.
Yeah, sure.
So it's Mega Life
Right.
who actually is the provider.
Who
Mega Life.
Mega Life. Okay.
Mm-hmm.
I think in New Hampshire we've had a significant problem with the lack of number of carriers who are willing to write insurance in our state. We've had that issue for several years. So I think there's a multi-pronged solution to this. The states do have a role, as does the federal government. But the reason that I voted against, for the repeal, is that I personally didn't believe that the law was constitutional, number one. Number two, I don't think it addresses the intended issues that the president brought up a couple of years ago when we started this debate. If we're truly trying to reduce costs for the employer and the consumer, I believe that there are better alternatives to address that. And secondly, and here's something that I learned today about Laconia, everyone in this room has access. First of all, there is a law that says if you come to the emergency room, you have to be treated. Now that may not exactly fit the type of coverage that you want, but for someone who is vulnerable, who can't afford it, who doesn't have it, whether they've lost their job, they're out of work, we are going to make sure that that individual has insurance through the existing law, number one. Gets treatment, number one. Number two, you've got HealthLink here, which, quite honestly, I think can be part of the solution for the country. I believe that health care is a very local issue. And when you have responsible physicians and a responsible hospital, as you do here, who are willing to put patient accessibility over their balance sheet, in front of their balance sheet, in front of their profit margin, you've got a good opportunity. I mean, you've got a great community that's working toward it, and that's why I wanted to go visit the hospital today and see if we can sort of incorporate some of those solutions. I enumerated a few things that I think the House will take up that will provide cost reduction. But to specifically answer your second part of your question, I don't take the federal health insurance, so I'm quite honestly not sure what the copay. I know there's a copay. I know that there is a cost. I don't know the answer about pre-existing conditions, but like many employers, I believe they offer tiered coverage. So it's going to be up to you as the employee or the member what level you take. But I opted not to take the health insurance.
May I ask
Sure,
just one thing?
sure.
If you opted not to take it, you must be pleased with what you have, I'm guessing. Because that's what I do. I say, oh, they're offering me this and they're offering me this, and this is how I determine who I'm going to go with for a healthcare provider. Could you get that information? Because honestly,
Yeah,
I've been very
sure.
curious as to what Congress actually got.
Sure. I will tell you, when I was Going back a few years, I worked for a congressman for a couple of years, and I opted, the insurance, the federal insurance was more expensive than when I happened to be an alderman at the time in the city of Manchester. And the benefit package for the city of Manchester was better than the package that members of Congress got. I haven't done the comparison now, but I'd be more than happy to get you exactly what is offered. I suspect it's public information, but we'll make sure we get that. And do we have all of her contact information? We'll get that to you right away. And let me add, I think it's important that, when Congress enacts legislation, they shouldn't exempt themselves. I agree with your sentiment there. And I appreciate the frustration that people have in New Hampshire and our country about the health care debate. It's a very emotional debate. I want to make sure that every American has the ability to have what they consider reasonable health insurance costs. But I will tell you, as a son my mother had breast cancer. That was a very trying time for our family. But I will tell you, as a family, we were able to make decisions. And that was, at the time, the most important thing to us. And I want to make sure that everybody has that opportunity to be able to make the decisions in that fashion. So we may have different views of how to get there, but I think that we can get to a reduction in cost by some of those alternatives. And as I continue to visit hospitals throughout New Hampshire, when there is a good idea that I see being implemented, believe me, personally, especially through the role that I have in the Oversight Committee that has jurisdiction of oversight and bringing ideas to the committees of jurisdiction, we will absolutely do that. I want to highlight those circumstances, those employers, and those communities. And while it may not be perfect, I think there is certainly greater level of access here, and you've got a community, a healthcare community that cares very deeply about its community and trying to make sure that the delivery and the access is there.